talk to me a little bit about how it's part of the National Comprehensive Cancer Guidelines and what this treatment, what was so innovative about this treatment that you were a part of?
Yeah. And so again, by preserving the uterus, we demonstrated that there was no worse oncologic outcomes. And so this became now, rather an experimental treatment, standard of care. And this is something that can be now offered to all women who have an early stage cervical cancer, and they should discuss this with their gynecologic oncologist. And again, by doing this, it allows women to retain their own uterus and carry their own child in the future for fertility preservation.
Elina, can a woman carry a baby to term without a cervix? And I think this is something that viewers at home want to know as well, and probably questions that you get when you meet with them.
Yeah, absolutely. So it's possible, and that's the whole goal of this procedure, is to allow a woman to carry a pregnancy to term, and not to mention the woman gets to keep her ovaries, right? So the child can potentially be biologically hers. The question of whether it can happen, yes, it can happen, but a lot of times it's harder for a woman to carry a pregnancy full term without some kind of an intervention from her doctor to make sure that the pregnancy is safe and carried out for the full term, right? And essentially, it's a risk-benefit kind of situation for every patient. Every patient's procedure is a little different, their anatomy is a little different, their biology is a little different, so outcomes vary, but it is possible, as Dr. Diaz, I'm sure, has encountered through his work and experience.